Archiving started.
Hello, everyone. This is Chapter 11, which is ethical and bioethical issues in medicine. There will be two chapters this week, Chapter 11 and Chapter 12, that we will have to go through. So hold on just a minute. I'm trying to get rid of some of this voice background stuff. Okay, so let's do a little bit about the early history. Way back in 400 BC, the Hippocratic Oath. Of course, Hippocrates was considered the father of medicine, and most of his principles, or many of his principles, are found in professional ethical codes today. His principles, all medical students, or many medical students, do follow. Ethical standards in behavior, just as a brief definition, they are moral principles or practices, customs of the medical profession, and matters of medical policy. Ethics is extremely important when it comes to anything that we do in our life, but it's particularly strong and looked at very closely in the medical field, all aspects of the medical field. Now, the next slide will be a little bit more on ethical standards and behavior. This is what happens if a person is accused of unethical behavior or conduct. First of all, they may get a warning or a criticism. It could be a censure of sorts, saying that, you did the wrong thing. The AMA, American Medical Association Board of Examiners, may recommend that the person who, in fact, has been found to have committed something against their ethical standards, that they be expelled or they are forced out, if you will, and it is expulsion or suspension. Expulsion is a pretty big word, and it would probably be a permanent type of a thing, whereas suspension can be for a certain length of time, and then the person can either reapply for admittance again, or it will just go away. If, however, the person is convicted of a crime, and this goes beyond the American Medical Association, we're dealing now with the laws of the land. So if, let's say, they were convicted of the crime, they may have imprisonment along with a fine, and they may very well, in fact, if the thing that they've done, the act that they have done or committed is serious enough, they may actually have their license revoked to practice medicine. That is huge. If you think about the many years a person would be going to school, undergraduate, graduate school, and then the training after all of the 16 years of school, it's pretty huge. So moving on to the Code of Ethics. Any organization is allowed to establish their own particular code of ethics. The AMA has theirs based on the Hippocrates feelings. The basic principles and behavior that is expected of all people within that discipline is clearly outlined within the Code of Ethics. When a person reads it and decides that they are going to join this particular group because it's a group of their peers, they know what's expected of them. So they are meant to govern themselves within that given profession the way everyone else does or should. Moving on, the AMA, American Medical Association Principle of Medical Ethics, the things that it does discuss throughout its language, human dignity, honesty, responsibility to society, confidentiality, of course, is broached, and the need for continued study because there's always something new to learn. Correct? All right, moving a little further down, the other thing that is discussed is patient autonomy, meaning that they have a right to be treated by themselves and not in a group, period. There is a responsibility of the physician to improve the community where he or she lives. There is, of course, a responsibility to the patient once they establish that there is a physician-patient contract, if you will. And there is support and access for medical care for all people, whether they can afford it or not. Excuse me one moment. I'm recuperating from a very bad upper respiratory infection, so I find myself thirsty. All right, so moving on down, we'll get to the Judicial Council of the Opinions of the American Medical Association. There are 9 members on the Judicial Council. They interpret the principle of medical ethics. If there's a question that comes up, there is, and if necessary, they can interpret or clarify anything within that ethical standard that comes up that needs any clarification at all. And the council will expect that all members of the group will cooperate with the physician in upholding these principles. That means anybody that they work with or for. So there are some other codes of ethics that you are probably familiar with. One of them is the Nurses Code of Ethics, developed by the Council of Nurses, and it discusses the role of nurses as they relate to how they practice their own profession, how they are perceived, and how they act in society and towards their coworkers, etc. There's also a little bit more when it says that they will have responsibility to the patient. Respect and dignity will always be foremost when they take care of the patient. They will be competent, meaning they will continue to learn. They will assume responsibility and accountability for judgments that they may make at times. And yes, I know we could have a discussion right here on res ipsa loquitur, or the thing speaks for itself, where the master or the physician is the person in charge and is responsible for everyone who works under their umbrella, if you will. Well, sometimes the nurses have to work all by themselves, and if that is the case, they have to be responsible for their own actions and their judgments that they make. There is the AAMA, the American Association of Medical Assistants Code, and this provides guidance for what it says here, many of the dilemmas that tell the right versus the wrong that an MA may face on a daily basis. There are lots of things that come up that need some clarification. So if you're concerned with doing the right thing at the right time, you look at the Code of Ethics for the American Association of Medical Assistants, if that's what your route is towards your final degree, and you'll see that you get quite a bit of assistance in being able to tell the difference right there. So let's go on to some of the bioethical issues. These are issues that result in advances in medical technology. There are lots of them. This is the 21st century. We're going to come across new things that were hardly even ever thought about 100 years ago. An example, or some examples, would be cloning, harvesting embryos to be implanted in utero to someone else. It starts with animal testing, and then in vitro fertilization. They have their pros and their cons, but above all else, it has to be done in an ethical manner with the utmost of dignity and respect for everyone throughout. I mean, imagine if some of the crazy people in history thought so much of themselves that they decided to get themselves cloned. All you need is a piece of fingernail or a scrape of your skin or a piece of your hair, and bingo. I mean, it's possible, and it's scary as all heck. Now, let's go to the ethics of transplant, the rationale, or the rationing. There's a lot of controversy that relates to transplant recipients, not so much the donors, but the recipients. In a donation, the organs are harvested or taken with the consent of the donor or the donor's representative after the donor has passed away. It is an act called the Uniform Anatomical Gift Act, and it permits competent adults to allow or forbid the use of their organs after death. Some may say that certain organs are allowed and others are not to be harvested. There are certain religions that don't allow any organs to be harvested. But in this day and age, when we can save lives after someone has passed away and they don't need their organs anyway, why not give someone else a chance to survive? And I have personal experience with this. My stepdaughter is a recipient of a double lung and heart transplant 7 years ago. Of course, that has to come from one donor because you can't have all of that stuff fighting against each other. And there's quite a way they have to do it. It has to be within 2 inches of your body size so that the heart will fit into the cage where it belongs inside the body. The lungs can be trimmed, but the heart can't. And you don't have time to see whether or not the tissue type matches. You only have time to see whether or not this is a good match for blood. And you pray for the rest. And in the case of my stepdaughter, and I do have permission to speak about this from her, she's a very lucky girl. But she got the heart and double lungs from a 17-year-old donor who was killed in an automobile accident, and the family did allow her organs to be harvested and used. And so my stepdaughter is alive today because of it. So let me go on a little bit further. There is a United Network for Organ Sharing called UNOS, and this is legal in the United States. It's responsible for locating and allocating organs for transplant. For some organs, the window of time that you have from the time the person breathes their last and are declared dead to the time they are harvested and implanted into a recipient is not that long. Different for liver, different for pancreas, but for heart and lungs, it's 4 hours. So a person can't die in California and expect that someone will deliver that heart and lung package to someone in Massachusetts within a 4-hour window to get it harvested and implanted in time for it to work. So it has to be within a 2-hour time frame for collection and a 4-hour window from start to finish for harvesting and transplant. It gives half weight consideration of medical need, the other half for justice. When it's decided exactly who needs organs and when and where. The National Organ Transplant Law of 1984 forbids the sale of organs in interstate commerce. So, when you see so-and-so offered to sell their liver to someone in another state, it's flat out illegal. Moving on. The ethical issues and personal choice, everyone has their own opinion and it must be respected. There may be religious or personal reasons for not wanting to be involved in a particular procedure. Preference should be stated before one is hired. If they don't want to work in a transplant area. Ethics of the employer must be in agreement with the ethics of the healthcare professional. So moving forward to the ethics of this particular research that's being done, here are some of the standing rules. Humans can't be used for testing unless they agree to participate in some sort of a test or whatever. They don't take their organ out, test it, and put it back, but it would be something where they can see how their body would react to thus and such of equipment or medicines, etc. You have to obtain consent, and it's lengthy and written, and there has to be justification for all medical research saying that the benefits outweigh the risks. So is a risk versus a reward ratio that's looked at. In this case, looking at the ethics of it, the benefits have to outweigh the risks. Okay. The researcher who's doing the testing has to stand by some very strong standards that have been set up for the testing itself. If they're working at an institute like any institute that's doing cancer testing or transplant testing, if they receive any kind of federal research money for grants, they have to have an IRB or an institutional review board to oversee that research and make sure they're not doing anything that is unethical. For consent, informed consent is necessary when a patient is involved in therapeutic research, so they know what's going to be done to them, how it will be done, how it will affect them if it works, how it will affect them if it doesn't work. So they have to know all aspects of the risks that are involved. They have to know the type of research that is involved here, and the physician has to explain every fact, and even if it means that the patient will decide at the end of the day not to participate. If it's dangerous, and it may be, the patient has the right to know what they're getting themselves into before they decide or agree to continue. Now, if there's a conflict of interest, it might come up where the researcher's interests are placed above the interests of the patient. Now, think about that. If the researcher has someone in their family that needs an organ right now, and the patient doesn't really know if they want to go ahead and do such and such a test to see if it's going to work, with a conflict of interest. They need to bring in a different researcher. Take that researcher who's got the patient in need of organs out of the picture for a while. So what happens when things go awry? There's whistleblowing. And this is when there is any one of us, doesn't have to be necessarily working day to day in this industry. It could be somebody who just sees something that's gone wrong, but they publicly report a dangerous situation. And that employee needs to exhaust all other means, have documented evidence, and believe that changes to prevent harm or injury will take place if they don't continue. So they better have a real good reason for doing what they're doing, and that's what this is all about. So there are some randomized test trials that require an ethical approach also. Many people believe it's unethical to use control groups as participants because they have no hope of benefiting from the study other than being, good guys helping out. Race-based control groups may produce an ethical dilemma because it might suggest that unless evidence, let me see how I can say this. It is unethical unless evidence suggests participants will benefit. For example, you can't use all African American participants in a cure for such and such unless it's going to show that they get this disease 12 times more than any other group in the United States, in the world. So there has to be a reason to choose a race-based group or any group at all of a particular, could be all white people, all people with blue eyes and blonde hair. It should be a pretty decent group of people that come from all walks of society. Now, there are some problems with a double-blind test. A double-blind test says neither the experimenter or the patient knows who's getting what. So it would be that there would be a placebo. A third party would come in and set up the medicines or whatever, and there would be a placebo involved. The only person who would know who's getting the placebo would be that third party. The experimenter who's conducting the study would not know until the end. And then the person who's getting the research treatment wouldn't know either. They may really want the drug just because they're trying to see if they can be cured of something, but this is a research thing. So this is a double-blind test. Nobody knows except the third party. The ethical question will come up sometimes with this double-blind test with informed consent. Informed consent means I'm telling you what you need to know versus implied consent. Implied consent happens when, let's just say you're going in to have your blood drawn, and you roll up your sleeve and you put your arm out. Nobody says, may I draw your blood today? But if you roll up your sleeve, put your arm out, and you get ready to be stuck by a phlebotomist, that is implied consent. I'm saying, I know what you're going to do, so just go ahead and do it. Versus informed consent, which is where I tell you. With this double blind, even though I mentioned it, let me just say again, the patients need to know that they may be getting placebo or the sugar pill, and they may not be getting any treatment whatsoever, and are they okay with that? So that is a problem that can sometimes arise with a double-blind test. The Human Genome Project begun in the 1990s, and it was completed in 2003. It's a research program funded by the federal government. Its purpose is to determine or map and sequence the total number of genes. A complete set of genes is known as the human genome. People say genome, but genome. The project provides, or will, when all of the data is read, a better understanding of the process of human evolution, and provide understanding of the relationship between certain genes and disease. The hope is that at the end of the day, more information will come on some of the diseases that have been particularly difficult to get to the bottom, the root of, and get something going on. The goal is the eventual elimination or control of genetic diseases. We'll go through those, but there are some really serious ones that you will need to know. Well, what about genetic engineering? Aha. This is saying, I want to have a little baby girl who's a fabulous ballerina and who is going to be 5'10" with blue eyes and blonde hair. That is gene therapy, that is cloning, that is adjusting that stem cell adjustment, that's playing God. That's all genetic engineering. I don't know that anybody's quite into that depth yet. I hope not. But cloning can be advantageous in certain things, like for certain animals. I mean, I was reading something recently where wealthy people were having one of their beloved pets cloned, so that when the day would come that their pet was going to die, they could clone a new one with the exact same traits and sweetness and intelligence and I really would have to think hard and long about doing it. My husband, first of all, would kill me, and I don't even know that I could afford it. But I'm not sure that isn't just a little too going too far for me. I'm curious to know what you guys think about that. Who would you clone, or what would you clone if you could? What I would do, if I could, is to get rid of some of the genetic diseases that, upon birth, take some of these just beautiful little infants and they have no chance of survival. It would be good to see that gone. Okay, so gene therapy. This is where you need a gene spliced onto the DNA of body cells to control the production of a particular substance. It's so new, not much of this has been done yet. The opportunities are huge. Scientists are certainly investigating it, but there are some ethical and moral problems, of course, because it's gene therapy. But you could see where they could come up with a gene that could be spliced onto an area of the pancreas and the islet of Langerhans that could, control the production of insulin, and diabetes would be gone. Pretty interesting. All right. And this is the last slide for this chapter. This is human stem cell research. The key point here is we call stem cells the master cells of the body. You will be asked that again. Please make sure you have that tucked away up here. The stem cells can generate specialized cells. They can grow in any or all tissues in the body. One means of obtaining stem cells is from the inner mass of an embryo. That's very controversial. Congress banned all federal financing for new stem cell research, saying we're not taking any embryos and disposing of them just for research. That would be horrible. But there's also stem cell that can be found in the placenta. It can be found in the umbilical cord, in the cord blood. It can be found in so many other areas and all kinds of tissue that it would be just awful not to be able to use the information to some good. And I'm certain that we will. I will stop this archive and continue with archive chapter 12, and we will go forward with the next chapter. Hang on. Maybe I don't have to. Hold on a minute. Let me see if I can go further. Go to 12. I don't think I need to do that. All right, I'm going to see if I can do this with one archive. And this is chapter 12, ethical issues relating to life. We've got fetal development. And the question, of course, is this: when does life begin? And this an age-old question. We believe that it begins at the moment of conception. The embryo stage is the 2nd to the 11th week. The fetus stage is the 3rd month. And at birth, the first breath is taken. So some people believe it's at the moment of conception. Some people believe when it becomes an embryo. Some people believe it's at the 3rd month when it has pretty much everything it's going to have, but it's small. And some people don't believe it still until it's at the moment of birth. And that's up to the different people. Assisted or artificial conception is an injection of seminal fluid into the vagina from the husband or a donor. Artificial insemination is AIH. And these are just some definitions that you need to know. Again, artificial or assisted conception, it's wise to require consent in writing from both the husband and the wife, because the artificial insemination donor, he donates semen for a woman who is not his wife. And the husband has to be okay with that. That's why the consent in writing works. What is the legal status of the offspring? Is it a concern? What are the ethical considerations in artificial conception? Again, very, very interesting. In vitro fertilization is where the ovum and the sperm cells are combined outside of the woman's body. The cells are grown in a lab and then frozen until they are ready to be implanted into a woman's uterus. In most cases, unused embryos are destroyed. I hate to say that, but it's just a fact. Embryos may be frozen for possible future implantation, and sometimes they are donated. A person can look into surrogate motherhood, where a woman agrees to bear a child for an infertile couple. There's a contract that is established, and the couple that is having the woman act as surrogate will pay all medical expenses. And the most famous one here is the case of baby M. If you have not heard about it, in your spare time, free time, I strongly suggest that you take some time and look it up. It's quite interesting. Now, ethical considerations for surrogate motherhood. Is it right for the mother to give up the baby she's carried for 9 months? Well, if it's not her egg and it's not her semen and she's just basically the incubator, how will she feel? I don't know. Only she will know. Does or should the child have emotional or physical link to the surrogate mother? Emotional, I don't know. Physical, yes, by the umbilical cord and the placenta. Will the relationship between the husband and wife be altered if the husband's sperm is implanted into another woman? Questions, questions, questions. Very, very strong ethical considerations. What is sibling relationship towards a surrogate baby? If a woman has become infertile and contracts with a surrogate to have another child, and it's not her egg, not her husband's sperm, is that baby that is born a biological child to the other children? Can the contract between a surrogate mother and a couple be enforced? Good question. It's gone to court. Well, there are some other ethical dilemmas with surrogate motherhood. You've probably seen this on TV too. There are potential court battles over who's going to have custody of the child. There's an embarrassment for a surrogate. Some have likened her actions to prostitution. I think that's grossly unfair. There's potential harm to the surrogate's own child when he or she learns she gave one away and received money in return. When they're very young, these children probably don't understand the gifts that their mom is doing. It's a difficult situation. And some more ethical dilemmas. Future emotional distress. Does it occur when the child learns she's taken from a natural mother? Reduces birth to a legal arrangement and the exchange for money to cover medical expenses. But it also allows an infertile couple the right to become mom and dad and have the baby or babies that they're so dying to have, to be a family. Interesting. All right, fertility drugs. Drugs that will enhance the ability to become pregnant. And people need to watch out because they can have, and they do increase the woman's chances of having multiple births. The physicians may recommend that some of the embryos be harvested out. It's called selective reduction. It's kind of tough to see. Well, I'll take that one and that one, but you can get rid of that one. It's a tough decision. Best example I can think of who didn't opt for selective reduction is Natalie Suleiman, Octomom, as we know her. So, contraception. Contra is the word that means against. Contraception is the union of male sperm and the female ovum. Several states have laws that prohibit selling contraceptives to minors. I wonder what their birth rates are. Well, now, what about sterilization? What is it exactly? It's medically altering reproductive organs to terminate the ability to produce offspring. It can be a vasectomy in a male or tubal ligation in the female. The elective procedure can be therapeutic, incidental, or involuntary. If it's voluntary, there are very few problems for anyone with this, for a competent person entering into the deal. It's become the most popular method of birth control in the United States, whether it's vasectomy or tubal ligation. The sterilization may be done if the mother's health is in danger, and it's sought for a variety of reasons. There has to be consent, a patient's written consent. Many hospitals require the consent of the spouse also, so that this isn't being done behind the spouse's back or without their knowledge. There is no current federal law that requires consent, however, but there is some rules that say the consenting individual has to be at least 21 years of age. Therapeutic sterilization may be necessary if the mother's life or if mental health is threatened. Now, what is eugenic sterilization? This is involuntary. It's considered to be unethical by many people. It's done to ensure or assure that parents will not pass defective genes onto their children. It has to be proven that it's in the best interest of the cognitively disabled person, and several states will allow this type of sterilization for sexual deviants and habitual criminals. Practice has lost favor, however, but there still are several states that will say you're going to be a sexual pervert, we're going to make it so that you can't have any more children with anyone for any reason. Now, what about negligence? Negligence suits related to sterilization. Once in a while, there will be a claim that will involve women who've become pregnant after the sterilization procedure. In some cases, it occurs during the sterilization procedure itself. It usually takes 1 to 3 months to be tested and to be sure that all of this, if a person has a tubal ligation or vasectomy rather, to be sure that all of the sperm are not alive. It is abhorrent to many people. That's some of the ethical considerations. Some critics ask if it's morally acceptable for those receiving any state or federal funds to dispense contraceptive devices. And this is a good question, should a violent sex offender be ordered to undergo sterilization? Why not? My opinion only, but why not? Some other ethical issues that surround sterilization and birth control. These are the questions that get asked to each other and in forums all the time. Should women who get or receive Medicaid and continue to have children by unknown fathers be required to be sterilized as kind of a punishment? Should mentally incompetent women be sterilized? Are children treated properly? Is human life being destroyed? All important questions. Now we're getting to some areas that are very specific, and they ask questions of our own morality and our own feelings, and you are entitled to anything that you feel and think It's okay to feel and think exactly as you do. These are just what's said about these particular procedures. What is abortion? It's termination of a pregnancy before the fetus is viable, and I say viable to live outside of the uterus. It can still live inside the uterus, attached to the mother, receiving oxygenation and nutrition. But if it is taken outside of the uterus, it would surely die. That is abortion. There is such a thing as a spontaneous abortion, which occurs naturally without any interference. It's a miscarriage, and it is not brought on by anyone's specific actions causing it to happen. It can be induced, caused by artificial means, by medical or surgical medications or procedures, but it can be caused by absolutely nothing at all, which is spontaneous. Well, there is the most famous case in the land, Roe versus Wade. This is a United States Supreme Court decision that declared that a criminal abortion law in Texas prohibited all abortions that were not necessary to save the life of a mother to be in violation of a woman's right to privacy. Now, understand that. The U.S. Supreme Court said that this Texas lady who was pregnant and wanted to have an abortion could not have one to save, because her life was not in jeopardy, and that's just the way that it went, Roe versus Wade. Criminal law in Texas prohibiting all abortions not necessary to save the life of a mother. And if that were the case, it would be a violation of a woman's right to privacy. An abortion would be allowed to save the life of a mother, but not, if it was not necessary, if the woman's life was not in danger, would not be allowed. The Supreme Court stand on abortion, first trimester, decision to have an abortion is between the woman and her physician alone. Second trimester, the state may regulate medical conditions under which an abortion is performed. The third trimester, the state may prohibit all abortions except to save the life of the mother or protect maternal health. That's what the Supreme Court says. The recommendations from the court's decisions is that abortions in the first trimester should be performed in a hospital. Approved process for abortions should include other physicians in addition to the woman's own physician. Viability of the fetus needs to be carefully defined. A woman should wait for a designated period of time before having an abortion once she decides that she wants to have one, and should receive counseling either way she goes. But should not say, I want it, and then go in and get it, in case she will regret it the next morning. Certain medical conditions, such as a partial birth abortion, should not be used. Period. The father's consent should be obtained. Those are the rest of the recommendations from the court. Now, historically, progression of cases affecting abortion, 1976, it was unconstitutional to require husband or parental consent before abortion. In 1977, states may refuse to pay for a non-therapeutic abortion, and then in 1980, federal funds may not be used to pay for Medicaid abortions. And that's the last we've had of that. Until after abortion, rather historical cases affecting abortion, there's a few more after that, 1980. 81, the physician has to notify parents or guardians before an abortion on a minor. That's a good thing. Federally funded family planning clinics are prohibited from giving abortion advice. In 1992, the trimester approach of Roe versus Wade rejected. It is looked at as undue burden on the mother. So, partial birth abortion, there's a great deal of controversy about this, but if the the fetus is allowed to enter the birth canal while it's still alive, and they're trying to abort it, it's horrific for me to even think about it. Essentially, I mean, it really is like taking a life that could potentially live outside of the uterus, and probably would, because it's in the third trimester, months 6 through 9, and so that child would have a right to live, in my opinion. Now, incompetent people, persons and abortions, difficult ethical issues arise when an incompetent person is suddenly pregnant with an unplanned or unwanted pregnancy, or they didn't realize what was happening because they are incompetent and didn't know what they were doing. In some cases, there is a guardian ad litem, which is the court-appointed guardian who will speak up for that incapacitated person and be their voice, so to speak. We could poll our entire class, and we would have issues all over the board about abortion. People have strong and differing viewpoints. I have mine. I'm sure you all have yours. The Unborn Victims of Violence Act in 1999 provides legal penalties for harm done to an unborn child at a federal facility, and it treats all unborn life as a person. I really like this law. I think, I'll give you my opinion, and it's just, as I say, my own personal opinion. I think it is left up to the woman. I don't say that I don't hold them responsible or say they're bad people for doing what they feel needs to be done. I just feel it's not right for me. And so for me, it wouldn't work. But for someone else, if that's the case, and their doctor goes along with it, I have to say that they have that right. Well, the employee's right to refuse to participate in abortions. Hospital employees have the right to refuse to participate, and they cannot be dismissed for that refusal or say that they're being insubordinate because they refuse. It goes against their personal beliefs, and it's a matter of conscious or religious conviction, and they cannot be penalized for it. Funding for abortion, there's a lot of controversy about this. Under the Hyde Amendment, the United States Congress limited the types of medically necessary abortions for which Medicaid monies might be spent. There's some ethical issues surrounding the abortion. Catholic Church and others believe it is immoral to deliberately take a life or kill an unborn child. Many people don't want tax money spent on funding abortion for women on Medicaid. And is it a violation of incompetent persons to have to submit to abortion? Is it appropriate to deny spouse consent? Should abortion be used for gender selection of children? Oh my. Abortion is always a moral decision because it results in the loss of human life. I cannot believe there's a person on the planet that would take this lightly. Baby doe regulations. Child Abuse and Prevention and Treatment Act protects a disabled infant, prohibits anybody from withholding medical treatment for that infant. Now, what about genetic counseling and testing? Before pregnancy, often a genetic counselor will meet with the couple to discuss if there is a potential for passing on a defective gene because of religious things that they may be subjected to, like Tay-Sachs or sickle cell for the African American. It's legitimate, and it's a wise thing to do for a couple to go to have genetic counseling and testing if they feel they might be at risk for passing on a genetic disease, potentially. There's prenatal testing. Amniocentesis is used where a needle is inserted to withdraw some very small amount of amniotic fluid, the fluid that surrounds the fetus, and the fluid is then tested for genetic defects. A consent form has to be signed because there are some risks that go along with this, and it may bring on premature or early labor. And what about harvesting embryos? Embryos selected to be destroyed. Pre-implantation genetic diagnosis. Test for I'm stumbling because this is something that I can't imagine saying, I'll take this, and this, but not this. You can take pre-implanted genetic, you can take genes that you have pre-implanted to test for genetic diagnosis and see if there's any problem with any of the diseases present that might be passed on. Genetic testing for newborns, it's a routine for all newborns, and it's become standard at hospitals. All states, every state has a law that requires testing for PKU, which is phenylketonuria, where they stick the baby's heel and they fill up the little circles with blood, and then they're looking for to see if there's a genetic problem there with purine. Now, do the parents have the right to be informed of all results of genetic testing? Does a person have the right to have children who are likely to be impaired, if they wish? Is society ever justified in requiring people to submit to genetic screening and counseling? I don't think so. Does a small number of people with potential for disease or genetic condition justify testing for all? Should public funds pay for genetic testing when a parent cannot pay? Why not? What about wrongful life suits? Lawsuits can be brought against a doctor when a baby is born with a severe defect. Sometimes this happens when the sterilization fails. It hasn't been 3 months and they thought that everything was intact, but it isn't. The wrongful conception, wrongful pregnancy, there was a case in 1991 where the parents were awarded cost of raising a child to adulthood after the child was conceived, and this was after an unsuccessful tubal ligation. So there was a wrongful life suit. Interesting. And lastly, the safe haven laws. Infants can be left in a safe haven, which will be a place that will care for them. It's hospitals, firehouses, police stations, churches, at almost any place these days is known at that's an open public place can be a safe haven for a parent to leave a child if they feel they cannot take care of them, they certainly don't want to hurt them, and they can't bear to face the shame of going forward and giving them up. They would just leave them. I'm not saying that's right, but it's certainly better than, God forbid, doing anything to harm them. Well, hopefully this worked, and these would be chapters 11 and 12 for week number 10, and it is going to be a trial. Let's see if it works. Take care, everyone. Have a great day.